Dr. Desai, I know you and I have talked a lot about how important health equity is, especially in medical dermatology. At Pfizer, we're very focused on those areas, not just on science, but also how do we apply our resources, our people, and our expertise in helping to advance this important topic. So I'd love to get your thoughts in terms of why is this so important and how are we doing here?
Well, I couldn't be more excited to talk with you about health equity because I think it's so important, and especially in a field like dermatology, where our science is based on visual examination, based on medical decision making, and really a partnership between board certified dermatologist, physician, and patient. Health equity really kind of transcends all paradigms of what we do. And no one's skin looks or feels the exact same way. That's the beauty of the skin. There are so many significant differences between racial backgrounds, ethnic backgrounds, identity, cultural practices related to the skin, and really diseases of the skin, hair, and nails tie into all that is something that really should be celebrated from the variety of different perspectives that we see in our practices. We really have to be aware that significant differences do exist in how these diseases present in different populations. For example, atopic dermatitis, which is a disease that does disproportionately affect patients of color. In fact, in the United States, African American children are almost 2 times more likely to develop atopic dermatitis than white children. In fact, it's 1.7 times based on recent data. Atopic dermatitis is also this disease that causes significant morbidity for our patients: chronic itching, excoriations, redness, burning, stinging. And looking for those classic features can be challenging in different skin tones. For example, redness or inflammation, which is a very common sign, also known as erythema, in a lighter skin tone patient, is easier oftentimes for us as a doctor to examine, whereas in a darker skin patient, it could be masked and not as well visualized. So this is certainly both an important topic from a diagnostic perspective, patient care perspective, and then also a cultural perspective for really our specialty and all of healthcare.
Oh, I mean, that was something that was really surprising to me as I got more into medical dermatology about how much, even in teachings and in photos, you are looking at white skin versus skin of color. And, we at Pfizer also are looking at the role that we play. We look at our clinical trials over the last 10 years and look at we're roughly at 38% in terms of Blacks or African Americans that are part of the clinical trials. So good progress, but we need to do better. So maybe my next question for you is, what can we as industry do better? I know Pfizer has, developed this Every Color is Primary platform with the intent to be very transparent about how we share this information and to hold ourselves accountable. But it'd be great to hear from you. What else can we as industry be doing here?
Well, I think first and foremost, it's education, and we need better education on treating and diagnosing diverse patient populations. Healthcare professionals need to feel comfortable talking about different skin tones, about cultural aspects for skincare, and that really ties into also continuing to invest in research and development. R&D is so critical for new therapies and access to these therapies. I think Pfizer must be applauded for being involved in this and really taking this to the next level. You mentioned clinical trials. I can't stress that enough because we need to continue to drive more diversity in clinical trials so we really get that outcomes data. And that ultimately leads to access to care and that equitable access to both therapies for patients, access to seeing dermatologists, access to understanding healthcare needs. And that can only happen with continued collaboration between industry, dermatologists, and our medical organizations. So I really think there's so many different things that can be done and already are being done.